Testing 1 2, testing 1 2. Can you hear me, Mr. Nkosi?
For the whole city. Yeah.
Testing 1 2, 1 2, testing.
Yes, from assist. But I see here there's
Yes, we can hear you.
Okay.
no connected on Wi-Fi. Okay.
Musa,
Yes.
you know, we hear you very clear, but there are people in the lobby. I don't know who's supposed to admit them. It's people that I don't know. I just want to say they are there. They're hanging. Just look, ask someone to admit those people, okay?
Okay, Eliza is here, is going to admit them.
Okay.
All right.
Yeah.
Okay. Bye-bye.
There will be now an opportunity for silent prayer or meditation. May we be seated. Let me take this opportunity and welcome our honorable members to this hybrid sitting, which is conducted through the Microsoft Teams platform and whereby some members are in remote attendance. This hybrid sitting is conducted in terms of Rule 3A of our standing rules, referred to as Rules for Sittings of the House and Meetings of Committees by Virtual Means. Honorable members must, however, note that our rules and orders are still applicable during the proceedings of this hybrid sitting, and we are therefore called upon to adhere to them. You are further requested to remain in attendance for the duration of the hybrid sitting unless a formal apology to leave the sitting has been duly tendered. The Secretary will ensure the provision of technical support throughout the sitting. Honorable members, all microphones must be muted and the video must be turned off. When a member is not speaking, when a member intends to speak, please click the icon to raise your hand. Once you are recognized by the speaker, please unmute your microphone and turn on the video to introduce yourself and speak. Statements by members. Are there any member statements? Honorable Mlombo.
Good morning, Honorable Speaker, the Honorable Premier, the members of the Executive, and my colleagues. Honorable Speaker, our statement reads as follows. The ANC-led government welcomes and supports the passing of the Criminal Law and the Domestic Violence Amendment Bills. The Domestic Violence Amendment Bill seeks to amend the Domestic Violence Act 1998 to provide the manner in which domestic violence and other related crimes can be dealt with. These bills are aimed at fighting gender-based violence and femicide. Domestic violence, Honorable Speaker, is one of the commonly committed crimes, and women and children are in fact the victims. The bill is a great step in protecting the victims, and they can, as per the provision of the bill, be able to speak freely without intimidation. Honorable Speaker, we request the concerned departments to work together in educating our communities about this important bill that affects our vulnerable people on a daily basis. Thank you, Honorable Speaker. Thank you.
I now call upon the Honorable MSc for Safety and Security, Honorable Shongwe.
Somlomo ngimthathele thuba ngibonge ngibingelele wena Somlomo ngibingelele malunga esishamthetho ngibingelele nabozakwethu nawo wonke futhi okhona la sibonga kakhulu isishukumiso esiphakamiswa ngomhlonishwa uChief Whip we-Majority Party ngale bill akhuluma ngayo. Ibill izama kusilekelela kulwa nalento ye-GBVF kumnandi ngayo ukuthi sesibonile ukuthi i-GBVF ayisiyo nje ukuthi iyaye kwesinye isikhathi kube ngibaba nomama noma kube ngumalume nomntwana or kube ngibhuti nosesa balwayo, kuyaye kungenelele amanye amacala aseceleni afana nabo rape, afana nabo banibani, nabo house robbery nani. Le bhili ke izama ukuthi silekelele lapho. Sibonga kakhulu lesishukumiso lane no Chief Whip ukuthi no indeed le bhili izosilekelela ukuthi sizame ukulwisana nalobugebengu okubona obusicekela phansi kakhulu okakhulukazi ebantwini besifazane kanye nezingane. Siyabonga.
Honorable Nyembe.
Thank you, Honorable Speaker. Honorable Speaker, I rise on behalf of EFF to raise a member statement that this August House note that there is a number of municipalities that were subjected to Section 106, which did not yield any fruits but consumed the little we have. Some are under administration in terms of Section 139B of the Constitution. Further notes that the various interventions fail to yield clean audit and reduce ISCOM debt or improve service delivery, but it allows fraud and corruption to continue without any consequence management or accountability. Madam Speaker, we should also note that the constitutional preventative measures of Section 139B and C are misused to settle political scores, instead of governing towards respectfully upholding the Constitution and the laws in compliance with the mandate. As I conclude, Honorable Speaker, we have auditors, PSC, which doesn't bite, but also consumes financially. As EFF, we would like to see all these tools given to this August House yield the desired outcome, not to settle scores. I thank you.
I now call upon the Honorable MEC for Cooperative Governance and Traditional Affairs, Honorable Shiba.
Thank you very much, Honorable Speaker. Section 1061B, Honorable Speaker, is an investigation that is being done when there are fraud within the municipalities. And after that investigation has been done, we then, all the findings, we revert them to the council so that the council must deal with those findings. We trained AMA MPEC, Honorable Speaker. I'm not so sure if Omemba Nyembe ati our yield any results Ushoktin, because there are findings and we are dealing with those findings from those Section 106. In terms of audit outcome, Honorable Speaker, ngiyavuma bengine meeting na AG with the Premier in the morning at 6:30. Yes, the results are not so good, but the Honorable Premier gave us, myself and MEC Finance, to deal with those issues so that we can be able to assist those municipalities that are still lagging behind in terms of the systems that are there, to check and monitor whether the systems that are in place they are doing the good things that they are supposed to do. Thank you very much, Honorable Speaker.
Honorable Lubisi.
Thank you, Honorable Speaker. The ANC is concerned by the recent incidents of carjacking and car hijacking happening around Gapogwen. The area is becoming a hotspot. We are reliably informed that there are 5 suspects terrorizing the community by forcefully taking their vehicles. Honorable Speaker, more than 10 cases of carjacking had been reported in 1 week. Some of the vehicles were found with the help of police, flying squad, and trekking companies in bushes around Kanyamazane, Mafambisa, and Manyeveni. Motorists must avoid being on the road as soon as it gets stuck and avoid parking on the side of the road for any reason. In some instances, the criminals use the gate remote control to tamper with your car when you jump off. Motorists are urged to check whether their vehicles are properly locked before leaving them. Also, along on the N4, we have learned that spikes are used, and when motorists experience tire puncture, they get hijacked. We urge anyone suspecting criminal activities to immediately call the Crime Stop number, which is 0860 010 111. Equally, we also call for police visibility at all times. I thank you.
I now call upon the Honorable MEC for Community Safety, Honorable Shongwe.
Somlomo ngibonge futhi okwesibili ngibonga kumhlonishwa uSibiya ophakamisa lesishukumiso. Uyazi Somlomo executive kuyajabulisa kakhulu ukuzwa isishukumiso esiphakamiswa ngumhlonishwa. Akaphakamisa isishukumiso nje ukugceka nokukhala nokuphonsa amatshe. Umhlonishwa uphakamisa isishukumiso uphinde futhi uxwayisa abasebenzisi beimoto ukuthi benze njani. Umhlonishwa uma umuzwa khuluma ungathi impela sobabili sirana le department. Ngifuna ukukubonga ke through uSpeaker mhlonishwa ukuthi uma uphakamisa isishukumiso kufanele uphakamisa isishukumiso uze namazwi ahlakaniphile nemibono ehlakaniphile nokuxwayisa imiphakathi nokufaka futhi imibono nje engasetshenziswa ukulwisana nalobugebengu obushoko bama-car hijacking ukufaka kwebhikiri emgwaqweni nani sibambisene sonke mhlonishwa nawe ungumholi through wena Speaker. Yiyo indlela yokulwa nobugebengu nobulelesi ngoba izigebengu kusanje zicabanga into entsha ezingaganga ngayo. Siyabonga kakhulu.
Are there any member statements? Honorable Morgan.
Thank you, Honorable Speaker. Honorable Speaker, I rise on behalf of the Democratic Alliance to deliver a statement. Honorable Speaker, it was common for this provincial government to construct homes with asbestos roofs in the initial RDP programs. A lot of these RDP homes, which were constructed by this government in the municipality with asbestos roofs, are now cracked. Honorable Speaker, in Temsilehani, there was a bad storm about 8 years ago, and during the storm, many roofs were damaged. As part of disaster relief, the affected residents were given PVC tarpaulins as a means of protection while the municipality fixed the roofs to the residents' homes. Honorable Speaker, as we speak now, it is 8 years later, and there are roofs which have still not been fixed. It is in these 8 years that these alternative roofs which were provided are also now leaking. Honorable Speaker, I hate to think how these people sleep on a cold winter's night or a rainy day without proper roof over their heads. Will the MEC prioritize this issue, and by when will these roofs be fixed? I thank you.
I will now call upon the Honorable MEC for Human Settlement, Honorable Mashilo.
Speaker ngiyabonga. Well, we note what Honorable Morgan just said. Well, the asbestos, they were there a long time before us. It's not a matter that we brought it. Majority we found them. However, we had a program some time ago to eradicate this. We could not have finished all the houses. And we take note that there are houses that are still left. We have done the audit and we are costing so that we can come to the conclusion how much we need, because it's not in the program of departments in this stage. But we take note of the issue raised by Honorable Morgan. Thank you.
Honorable Weber.
$48 million corruption that has taken place within the Mpumalanga Department of Health, but welcomes any investigation into this. Whether the EFF statement regarding the arrest of the 8 departmental officials is correct, or whether the counter statement from the police indicating that no arrests have been made is true, the Freedom Front Plus firmly believes that the Premier of Mpumalanga should stay true to her previous State of the Province addresses when she spoke of the need for lifestyle audits for politicians and departmental officials alike, and promised to root out corruption. It is with great concern that the departments such as the community safety as well as health have been implicated in COVID-19 PPE tender fraud, and we again need to test the ANC's political will in authorizing lifestyle audits of implicated politicians and officials. What we should all realize is that corruption is a form of radical economic transformation, and the reason we say this is that despite billions of rands being lost to an authorized expenditure, no one senior ANC politician or senior departmental official has been charged, found guilty or sentenced for large-scale corruption. The onus for the large-scale corruption rests squarely on the shoulders of the ANC government, as well as ANC employees within the Department of the South African Police Services, who more than often than not simply do not follow up on these charges. I thank you, Madam Speaker.
I will now call upon the Honorable MEC for Health.
Thank you, Honorable Speaker. We welcome the statement by Honorable Weber. Indeed, it's good that you are even correcting in terms of facts that there's no one in the department that has been arrested, and the matter is within the SAPS that have since responded to the matter. And as a Department of Health, we support any form of law enforcement that will deal to uproot corruption in the department. And that will be supported by myself as the MEC, that there are no corrupt activities that are happening in the department. So welcome that if there are any investigation, if those that will be found to be the wrong side of the law, they must be found, the law must take its course, and we're supporting that as a department. Thank you very much, Honorable Speaker.
Executive statements. Are there any executive statements? I will call upon the Honorable MEC for Public Works, Roads and Transport, Honorable Lachminarain.
Thank you, Honorable Speaker. Madam Speaker, the Department of Public Works, Roads and Transport in this financial year has embarked on the process of finalizing the purchasing of pothole jet patches. This new innovation of patching potholes will ensure that all routes leading to tourist destination sites are prioritized. We have also budgeted 50 million rand to revamp the KwaMhlanga Government Complex, a project that is going to be implemented this financial year. The team of specialists has already went on site to assess the work, and we intend to spend the bulk of the allocated money on the project. Honourable Speaker, the Minister of Transport, Honourable Fikile Mbalula, during his oversight visit for the N4 project, requested that the department should coordinate a stakeholders meeting for the Moloto Rail Corridor. It is a request that will be executed without failure. Madam Speaker, the horrific accident which occurred on the 21st of May 2021 at Moloto R573 road has further exacerbated the immediate attention of government to address the Patco business chaos. We are making progress in this regard, and we must make sure that the families of the deceased are properly taken care of. I thank you.
I will call upon the economic freedom fighters to comment. 3 minutes.
Thank you, Honourable Speaker. Well, as the EFF, we are very much concerned about the foot bridges, more especially in Mariti, wherein the learners are forced to cross the river when going and coming back to school. And for many years now, the department has done nothing. Whereas we have been indicating, even the councillors of the ANC have been indicating to the department that they need a footbridge in that area in order for the learners to freely cross the river going and coming back to school. I think we must also prioritize that, Honourable MEC, as a matter of urgency, and also a footbridge in Elandshoek. There is a lot of fatalities for the residents of Elandshoek happening there when they crossing the road towards Ngotwana from both the villages. So we will also appreciate if those program of footbridges were necessary, they can be prioritized. We welcome the innovation of the pothole patching, because the potholes has cost us a lot, and the department or government a lot, because they have to pay for the damages caused in the people's vehicles. But we also caution the department that unlike before, there must be proper allocation of these job opportunities or business opportunities to all deserving business people of Mpumalanga. Not only one or two companies wherein we find that it's allocated a budget of 29 million rand instead of them sharing the 29 million rand as many companies that are doing business with the government. I thank you.
I will call upon the Democratic Alliance. 3 minutes.
Thank you, Honourable Speaker. Honourable Speaker, the MEC has just delivered her executive statement on public works, roads and transport. I believe that by this stage we are all aware of the impact which the COVID-19 pandemic and the extended lockdown had on the economy of our province. It is scary that we were the worst affected by job losses in our country, as we lost close to 130 jobs, if not more. Honourable Speaker, and in addition to the above, the tourism sector was the worst affected by the related lockdown of our country. Until now, it is struggling to recover. Given this statement, our provincial government must do everything in its power to sustain the sector and inevitably grow the economy. For many years, tourism has sustained a lot of families in our province, and it is said that so many years, the condition of our roads leading to these destinations is dilapidated and being referred to as potholes with tar. Being a major deterrent, I am happy that the MEC has announced the purchasing of pothole patches to deal with the treacherous conditions of our roads, which is either chasing away tourism or causing accidents. Honorable MEC, over the past couple of years, we have heard many of strategies for dealing with the potholes in our province, one of which was termed the war on potholes. This was envisaged by Sasekani Manzini in 2017, and as it is said that till today, this never materialized. Given this, Honorable MEC, I am skeptical, especially since your executive statement does not bind you or your department to set a delivery target or rate of delivery. Honorable Speaker, in concluding, I believe that the COVID-19 extended lockdown destroyed the tourism sector and threatened livelihoods of the people depending on tourism. As such, we have to focus on our tourism routes in the province and maintain the roads, which are now a major deterrent. Honorable MEC, I would especially like it if, in the interest of accountability, you can provide a target for your department to meet and a program. You need to say prioritized by when. I thank you.
I will now call upon the African National Congress. 3 minutes. Sorry for that. I will call upon the Freedom Front Plus. 3 minutes.
Madam Speaker, I think we are all concerned and worried about the state of our roads in the province. But my point of departure maybe is a bit different, and maybe even I'm becoming from an opposition party. But I have been attending meetings during the last 2 years together with the Honourable MEC, Honourable Lakshmi Narain. I have experienced her as a person of high intelligence, a dedicated person. And I want to state clearly, I have confidence in her. I believe her. When I visited her in her office, she assured me that she wants to have Mpumalanga as a pothole-free province. I want to give my square support to her, and I believe that if ever there's a person who can do it, it's Honourable Lakshmi Narain. She has my full support to doing what she has promised to me. I thank you.
I will call upon the African National Congress. 3 minutes.
Honourable Speaker, thank you very much. Let me anchor what my honourable member from the Freedom Front have already indicated, that we have confidence in the leadership of the Honourable MEC, Honourable Lakshmi Narain. We have worked with her in the legislature. We know what she is capable of. And we are confident that she does understand the importance of the department that she is leading, because that department is responsible for the entire infrastructure development in the province, and that department is strategically positioned to be able to contribute effectively towards the growth of the Mpumalanga province, and it's strategically positioned to ensure that it contributes fully towards job creation in the province. As we indicate and pledge our support, we must indicate that this program of pothole patching, it's a very important program, because the entire South Africa, our priority, the entire departments from national, provincial, and local, the priority is to ensure that the SMMEs are accordingly developed to be able to play an important role in the development of our economy. So is the tourism economy an important and priority in terms of the development of our economy. We think that the MEC does understand that tourism in the province is one of the strategic pillars that are targeted to increase the economy of the province. But however, we want to caution and request the MEC to look at all the roads across the province. The Mananga Road, there is a challenge with that road. We cannot close our eyes and pretend that we are not aware as to what is happening there. The sooner we give a clear response to the people of Nkomazi, especially around Mananga, in terms of that road, the better will it be for ourselves. But lastly, I must indicate that the MEC and her department, in the process of the infrastructure development, they will have to concentrate on youth SMMEs development and women SMMEs development, because it is the youth and mostly the women of this province that plays a pivotal role in terms of ensuring that they jack up the economy of the province. So we request the MEC to prioritize that sector, the youth and women sector, in terms of tourism economic development. We thank you. We welcome the executive statement. We thank you.
Motions without notice. Are there any motions without notice? Honorable Shope.
And my hand is up also, Honorable Speaker. I don't have that device on my laptop, my gadget.
Thokoza Somlomo. The ANC would like to move a motion without notice and commend the SABC for recording a profit of 43 million for a month of April 2021, noting that this public broadcaster has not recorded such profit in 5 years. It has reported that its advertising revenue was 15.5 million above budget, while sponsorship revenue was 25.9 million above budget. The turnaround strategy of the SABC is bearing fruits, Honorable Speaker. We therefore expect other state organs to take a leaf out of this good performance from SABC and implement similar strategy that are profit-driven, so that these monies can be used to benefit the needy. I move that this August House join the ANC in encouraging such good performance and good governance of the public entity. I so move, Honorable Speaker.
The question before the House is whether we agree to adopt the motion. Agree to?
Agreed. Agreed.
ESO agreed.
Agreed.
Agreed. Honorable Grobler.
Thank you, Honourable Speaker, and greetings to the House. Honourable Speaker, I rise to deliver a motion without notice on behalf of the Democratic Alliance. Honourable Speaker, an awful lot has been said this morning already about the roads in the province, but I recently did an oversight visit at the Slyhoek Road in the municipality of Emakazeni. The above-mentioned road is a provincial road, which plays a pivotal role in the daily happenings of Watervalboven. It leads to the hospital, then further to the dumping site, and further to that it leads to tourist destination sites where people do rock climbing. Upon my oversight that I conducted, I was surprised to see that once the TAR ends, so MEC, in your executive statement, you said that potholes will be eradicated out of the province, but yeah, the TAR completely ends. And this is the area where the road leads to the dumping site, which causes people to do illegal dumping because they don't want to go with their cars onto the gravel road. And MEC, you can think of the difficulty for tourists to get to the sites where they can do rock climbing and also have accommodation, tourist accommodation. We spoke about the contribution of tourists and their accommodation in the province. And therefore, Speaker, I want to note that this road is in a terrible condition, and I move that this House calls on the MEC to prioritise this road to ensure that it's fixed and maintained thereafter. I so move.
The question before the House is whether we agree to adopt the motion. Agreed to?
Agreed.
So agreed. Are there any motions without notice?
Yes, Speaker, I'm here. Honorable Sidibe.
Honorable Sidibe.
Thank you very much, Honorable Speaker. I rise on behalf of the EFF to raise a motion without notice. In that, upon doing oversight in the Department of Health and the hospitals, the EFF established that most of the hospitals are not receiving PPEs and medication because, even the clinics, due to the non-functioning of the medical depot in Middelburg. This came after an incompetent and not qualifying company was appointed or awarded the tender to manage the medical depot, which is the heartbeat of the people of Mpumalanga. This also resulted in many patients and sick people and injured people not getting the necessary medication and assistance from the hospital. And this resulted to other people dying in the course, whereas the nurses are on strike and go slowly because of this problem. I therefore, Honorable Speaker, move that this House lay together made a charges against the MEC for Health and the Premier for the genocide, because many people have lost their life because of shortages of medication. I so move.
The question before the House is whether we agree to adopt the motion. Agree to?
Agreed.
Motion is defeated.
We don't.
Also, we don't care about the life of our people. People must die and we must just keep quiet. So,
Honorable Sidibe, the motion is defeated. Is there any motion without notice?
Civil society and the EFF.
Honorable Speaker, Honorable Lakshmi Narain.
Honorable Lakshmi Narain.
Thank you, Honorable Speaker. I rise to move a motion without notice on behalf of the African National Congress for this August House to congratulate the African National Congress in Mpumalanga for winning the following wards that were contested on the 19th May 2021 in the 3 regions. Karsibande region, Pixley Kaisakeseme Municipality, Ward 7 with 55.4%. Nkangala region, Steve Swete Municipality, Ward 22 with 66.63%. Etlanzeni region, Bushbuck Ridge Municipality, Ward 21 with 81.9%. Further noting that the very same ward in Bushbuck Ridge was the ward belonging to Bushbuck Ridge Resident Association, later known as Better Resident Association. Honorable Speaker, this outcome is also a positive building block towards a decisive victory in the upcoming local government elections to be held on the 27th October 2021. Honorable Speaker, we further want to thank all voters who came in their numbers to cast their votes and further demonstrate the resilience of our hard-earned democracy. Our heartfelt gratitude goes to our volunteers who, under this difficult time of the pandemic, reached out to voters in ensuring that the ANC remains the people's choice. I so move, Honorable Speaker.
The question before the House is whether we agree to adopt the motion agreed to.
Yes. No, Speaker. But we can amend it to congratulate the DA as well. Then we'll adopt it.
Defeated. Is there any motion without notice? Notices of motion. Are there notices of motions? Honorable members, Honorable Chrobla, honorable members, the rules of the House are still applied in this sitting. Can you please adhere to the rules of the House? Let's make sure that we maintain the decorum of the House, as members are expected to conduct themselves in the House. Honorable members, we are now on notices of motions. Are there any notice of motions? Formal motions. I am informed that there are no formal motions. We'll now proceed with the order of the day. Orders of the day. The Secretary shall read the first order of the day.
Order number 1, Policy and Budget Speech on Vote 10, Department of Health.
I now call upon the MEC for Health, Honorable S.J. Manzini, to deliver the policy and budget speech.
Madam Speaker, Honorable M.E. Masilela, the Premier, Honorable R.M. Tsweni, my colleagues in the Executive Council, Deputy Speaker, Honorable J.J. Skosana, Chairperson, Honorable J.L. Tabete, and members of the Portfolio Committee on Health and Social Development, members of the Mpumalanga Provincial Legislature, leader of the opposition party, Honorable Esidibe, leader of the House of Traditional Leaders, Nkosi Ngumana, executive mayors, MMC, and all other councillors, pastors in our midst, secretary to the Mpumalanga Provincial Legislature, Mr. M.H. Shabangu, presiding officers of the Mpumalanga Provincial Legislature, acting DG of the Mpumalanga Provincial Government, Mr. T.P. Nyoni, acting head of Department of Health, Ms. D.C. Mdluli, head of other provincial departments, traditional healthcare practitioner, traditional leaders, organized labor, hospital boards and clinic committees, governance structures of the department, managers in the Department of Health, healthcare workers across the length and breadth of the province, our strategic and developmental partners, all stakeholders of the department, people of Mpumalanga province. In his last letter written before he was murdered in 1961, President Patrice Lumumba wrote, open quote, "Africa will write its own history.
and it will be to the north and to the south of the Sahara, a history of glory and dignity, close quote. These powerful words by Congo's first democratically elected president best capture the evolution of South Africa's health system, from which was only developed for few to a caring and humane society in which all South Africans have access to quality health care. It is common cause that the ANC-led government has, since the advent of democracy, worked tirelessly to write a history of glory and dignity for South Africa's healthcare system, with a particular focus on expanding health services to the historically marginalized, especially those in rural farming and remote areas, because their needs, which are fundamentally different to those in urban areas. It is in these areas that you find more vulnerable people who experience a higher level of unemployment or underemployment, who has to travel longer distances to the nearest health facilities with higher associated costs than urban areas. Given these relatively higher levels of deprivation, it is expected that the social determinants of health will contribute more significantly to the burden of disease in rural areas, and therefore the unavoidable need to change their realities to that of the glory and dignity. We have recorded some successes against the backdrop of the assertion that health services are inequitable provided to the historically marginalized, especially those in rural, despite a range of progressive policies adopted and implemented since 1994. Our achievements include the removal of user fees for all clinics and health centers and for pregnant mothers. The idea was to increase access while also improving service coverage for these rural areas. This is something of note, particularly as we celebrate the 150th birthday of Ma'am Charlotte Maxeke, an unmatched women's rights activist and intellectual. Charlotte Maxeke is a trailblazer whose courage and outstanding achievements continue to inspire us to write a history of glory and dignity for Africans. Honorable Speaker, we will not be honest to this House if we concealed the truth that the task of writing a history of glory and dignity for South Africa's healthcare system is confronted by myriad of challenges which require our collective wisdom and effort to overcome. Serious health system challenges and the problems of inequity remains acute. There are huge inequities in the human resource availability between the private and public sectors, and as well as between urban and rural areas in South Africa. The key human resource challenges relate to production, recruitment, and retention of health workers, which results to inequitable distribution of healthcare professionals and poor access to health services, particularly in rural areas. The crucial role of human resources in health system cannot be overemphasized. The health professionals remain the only single precious commodity whose contribution cannot be reduced to rands and cents, because they have remained loyal and true to the call of their profession. We appreciate the contribution of all the health professionals who have chosen to be part of writing a history of glory and dignity for South Africa's healthcare system by remaining in the public sector and in the country, working selflessly at the coal face, warding off all enduring hardship, and also continue to deliver health services for our people. The healthcare sector is not only labor intensive, but also depends on precise application of the knowledge and skills of its workforce to ensure patients' security and health. Therefore, underproduction of the health professional on one side and increased burden of diseases on the other have a domino effect on the quality of health services and undermines our mission of writing a history of glory and dignity for South Africa's healthcare system. The legacy of inequality, both in relation to income distribution is in access to social services, is still being felt. A range of studies have detailed the major equity challenges facing the public health sector even today. the total and limited amount of resources available to the South African government has a major impact on health and care financing. And the recent budget cuts are not making it any better. The austerity budget confronting all government departments are proving to a major challenge in the writing of a glorious history for our healthcare system as they limit what can be done. There's no doubt in my mind that there is an urgent need for alternative financing sources if we are to make a dramatic and rapid progress towards achieving the goal of universal access to health services and writing a history of glory and dignity for our healthcare system. Honorable Speaker, this we must address as a matter of urgency. It has already been established that it is the financing of healthcare in South Africa that contributes to the inequity. In the face of the current stagnant medical scheme coverage and a growing population, more people are relying on the public health services for healthcare. The result has been significant pressure on the public health budget. While allowing the private sector to survive, we also need to protect the interests of the general public and their right to access healthcare. We need to ensure that these resources benefit the majority of people who require healthcare so that we get the best value for each rand we put into health. I'd like to acknowledge that the South African health system faces a challenge of balancing the need to provide universal access to healthcare services with ensuring affordability and sustainability of the health financing system. While the international experience has great value and provide important lessons, ultimately we must find a solution that is appropriate for our South African circumstances, bearing in mind that the limitations we face in the continent are much more pronounced than those of the developed world. It is critical that we have a basic package of care that is properly costed to an affordable level to ensure that the majority of South Africans have adequate cover that is affordable. We can reduce inequities in healthcare financing by improving income and risk-related cross-subsidies while improving access of lower income groups to qualify healthcare. This way, we will be addressing the dual challenges of providing universal access to all while obtaining payments from all those who have the means to pay, while some proportion continue to use private facilities and thus reduce the burden on public services. In a nutshell, national health insurance will be critical in writing a glorious and dignified history of South African healthcare system. Madam Speaker, I'm addressing this August House today after a full year being at the height of a deadly pandemic, coronavirus, commonly known as COVID-19. This virus has brought panic, anxiety, horror, insecurity, and grief around the world, as well as economic devastations. Madam Speaker, as the province, as at 9 June 2021, we have recorded 84,501 cumulative total cases of COVID-19 and 81,139, which is 96%, have since recovered, while 1,898, which is 2.3%, are active cases, which is placing the province on an alert for third wave. It is heartening to report that 1,464, which is 1.7% cases, have lost their lives since the pandemic started. May their soul rest in peace. The highly affected district being Ehlanzeni, that has contributed 33,591 confirmed cases, followed by Nkangala with 26,019 cases, and Gersibande, that has contributed the least with 24,891 confirmed cases. The image of COVID-19 globally has brought about both desirable and non-desirable effect. One of the positive outcomes is that we have learned to utilize the innovations of the fourth industrial revolution, which in my thinking is an initiative that is here to stay because it actually makes life much easier for all of us to meet anywhere and at any time. As a province, our fight against COVID-19 has been an intense one, and our strategy is built within the following pillars, which are active identification of cases through community screening, testing, and contact tracing, isolation and quarantine, which our dedicated and committed frontline healthcare workers have led. And the Honorable Premier launching of ward-based and the behavioral change assisted us as a province to make sure that we kept the spread of the COVID-19. Madam Speaker, scientific data shows that vaccination against COVID is the most effective intervention that can interrupt the transmission of the virus by building herd immunity amongst communities. Our vaccination program, which started with the vaccination of healthcare workers, was launched on the 17th of February by our Honorable Premier, Ms. Refilwe Mtsweni-Tsipane, and we continue with the rollout vaccination program in phases. To date, I can report to this House that we have vaccinated 21,110 healthcare workers through the Sisonke Open program, which was phase 1 of the rollout program. Currently, we are busy with phase 2 of the vaccination program, and we are prioritizing the citizens who are 60 years of age and above. To date, we have already vaccinated 63,336 elderly people out of the 121,858 who have registered to be vaccinated. We are targeting 333,001 of our elderly people over 60. We continue to encourage our people to enroll on the vaccine data system. The following programs are implemented to improve registration. Community mobilization programs, which are led by local leaders and influencers through local media, partnering with strategic local retailers such as COGTA, whose pension pay point that has already signed an agreement with the department as a vaccination and registration site. Partnering with all government stakeholders to help mobilize and offer a helping hand to all senior citizens that cannot self-register. Challenges and success as a department, we are of course having challenges, Madam Speaker. The department appreciates the support from the Executive Council through the Provincial Command Council that has led us to successfully resolve and overcome some of the challenges that came with the effort to fight against COVID-19. Madam Speaker, one of the strategies that assisted the department in the fight against the pandemic was the clinic-based model that is interlinked to the ward-based model that was introduced by our Honorable Premier. The clinic-based model for COVID-19 disease prevention model is aimed at integrating COVID-19 related activities into the mainstream of the primary healthcare service system, delivery system through a strong partnership and involvement of all stakeholders within the communities. This model focuses on strengthening the department's effort on primary healthcare service delivery closest to communities, thus increasing the accessibility and ensuring that COVID-related preventative measures continue to take place. Madam Speaker, I can report back to the August House that 251 out of 290 facilities have launched the model, and our clinic-based model to COVID-19 is specifically targeting those with underlying comorbidities such as diabetes, mellitus, hypertension, asthma, HIV, that put them at higher risk of infection and death from COVID-19 complications. Madam Speaker, it is evident that NCDs have contributed to the mortality of COVID-19 patients. Those are the people with hypertension, diabetes, and obesity, ranking as among the top comorbidities complicating COVID-19 and contributing to mortality. Mpumalanga Province will strengthen its system in partnership with communities to control NCDs through the implementation of the clinic-based health model during and post-COVID-19 to ensure that screening and management of those affected by the NCDs are detected and treated on time. I will therefore soon be launching a special project, first of its kind, in partnering with the World Health Organization of knowing your NCD status. During the launch, community health workers will be screening people for diabetes and hypertension at their own household, because some of the people who are found to be COVID-19 positive, they do not even know that they are hypertensive and diabetic. Madam Speaker, the department has set aside 20 million to procure equipment to take blood pressure at facility level, and we have received 1,000 BP machine donated to the province to be used by community health care workers to screen people for hypertension. Madam Speaker, let me come back to the commitments we made as a sixth administration to attain the MTSF 2019-2024 5-year implementation plan. The plan focuses on the 7 priorities and related intervention of the 6th administration of government. And as a health, we respond to priority 3, education, skills, and health. As a Department of Health, we align ourselves with Vision 2030 of our National Development Plan by prioritizing effort towards universal health coverage through implementation of programs that will ensure a long and healthy life for the citizens of Mpumalanga. Madam Speaker, significant strides have been made in the attainment of the above-mentioned aspiration to improve health of our people. Maternal, child, women, and youth health. Madam Speaker, we do need to appreciate the impact of COVID-19 on the health outcome, where the different lockdowns restrictions reduce utilization of our primary health care services from 2.1 visits per client in 2019-20 to 1.2 visits per client in 2020-21 financial year. However, the impact of COVID-19 is evident in most of our health outcomes, including child health and the management of HIV and AIDS, TB, and STI. To improve management of maternal and child health care services, the department is implementing a strategy to accelerate implementation of programs focusing on the reduction of maternal and infant mortality. Furthermore, catch-up plans have been developed and are implemented to retain clients on ARVs and to get more clients tested to know their status. Madam Speaker, the following interventions are key in attainment of the above-mentioned strategy, and COVID-19 affected those outputs. To decrease maternal morbidity and mortality, the department has managed to achieve the following. Antenatal first visit before 20 weeks rate is at 75% against the target of 75%. The mother postnatal visit within 6 days rate is at 74% against the target of 65.6%. The department also managed to initiate 98.4% of antenatal client on ART against the target of 98% in the current financial year. The cervical cancer screening coverage 30 years and older is at 86% against the target of 80%. The above performance has been realized in the reduction of maternal mortality from 92.4 per 100,000 in 2018-19 to 66.6 per 100,000 in the year under review. The department has also managed to achieve the following with regard to the reduction of the child morbidity and mortality. The infant first PCR test positive around 10 weeks rate is at 0.61% against the target of 1.3%. The immunization under 1 year coverage is at 92% against the target of 90%. 29,572 school grade 1 learners screened for learning barriers and health-related challenges against the target of 25,870. Vitamin A, 12 to 59 months coverage is at 51.1% against the target of 60%. The department has managed to exceed the target of cataract surgery rate of 1,600 to 1,728 due to the project that involved both private and public doctors. The department reduced the malaria case fatality rate to 0.3% against the target of 0.5% in the year under review. In terms of the increased life expectancy, Madam Speaker, I'm pleased to report that according to the mid-year population estimates 2020, life expectancy at birth in the country has increased from 54 years in 2006 to 65.5 years in 2020. The people of Mpumalanga also continue to live longer as their life expectancy at birth has increased from 54.1 years in 2006 to 64.3 years in 2020. Madam Speaker, despite the scourge of the COVID-19 pandemic, 10 out of our 32 hospital achieved the ideal status for self-assessment, and 96 out of 289 primary healthcare facilities achieved an ideal status. The department is gearing itself for public health establishment in the province to be ready and accredited for national health insurance through the National Health Quality Improvement Plan. 2 quality learning centers have been established to accelerate quality improvement through public-private partnership. In terms of access to tertiary services, Honorable Speaker, I would like to appreciate Prof. Zebulon Vilakazi, the Vice Chancellor of Wits University, for collaboration between Mpumalanga Department of Health and Wits University by providing much needed comprehensive oral health services to our people through collaboration. The African child will no longer suffer the agony of toothache and extraction of teeth. They will have a preservation of all their teeth when they reach pension age. Rob Ferreira Witbank and Temba Hospital are soon to be accredited by the Health Professional Council of South Africa as part of training platform for final year dental students. Our people will benefit from partnering with the university such as VETS, which is ready to assist and supplement our needs. Madam Speaker, during the 2019-20 financial year, the department launched the medical oncology services in Rob Ferreira, the first in the province since the dawn of democracy in 1994. Currently, only chemotherapy services are provided in the province. This was part of the department's plan to improve the access of specialist services in the province. In April this year, oncology services were also established in Witbank, where our Honorable Premier officially launched the services, with a view to phase in the full services. Cancer patients in the province no longer have to travel for 4 hours to be seen and by the oncologist. This has improved the overall care of cancer patients in the province. The next phase is to establish radiation oncology with the support of National Department of Health and Wits University. To this end, the team of specialists from the department and Wits University has been established to oversee the process of establishment of radiation oncology services, which is more complex from the therapy. Madam Speaker, the department launched the establishment of 24-hour radiology services in April 2020. Currently, Rob Ferreira, Witbank, Temba, ML have full-time radiologists daily. This has greatly improved the early diagnosis and prompt intervention by clinicians, especially when dealing with multi-trauma patients and other life-threatening conditions. For the 2021-2022 financial year, the department has already commenced processes to procure a CT scanner for Mapulaning Hospital. This will ensure that all the regional and tertiary hospitals in the provinces to provide 24-hour radiology services. Madam Speaker, building tertiary services in a rural province like ours require diligence and patience, and the department is on the right course towards this realization. In this regard, the department is continuously engaging other universities to come on board towards this course. Madam Speaker, the department continues to prioritize provision of emergency medical services and inter-facility transfer. However, we shall not remain complacent as more still needs to be done. We'll therefore prioritize integrating PPTS into EMS to ensure that those clients who need priority care are attended with the speed they deserve with EMS. Madam Speaker, despite COVID-19, the department continues to prioritize on increasing access to quality health services for the people of Mpumalanga by improving the implementation of 10-year health facility planning and infrastructure delivery program. Today, the following can be reported. The department continues with its long-term high-tech upgrading and construction project and has allocated 214,423,000 rands for the completion of the following: the upgrading of Mamitlake Hospital Phase 3, the upgrading of Bedal Hospital Phase 3, upgrading of Rob Ferreira Hospital nursing accommodation, upgrading of Impungo Hospital. The Department of Health is continuing with construction of new Middleburg District Hospital, Mapulaning Hospital Phase 3B, new Kanyamazane CHC, as well as construction of Temba and Kwamhlanga Hospital Maternity Project. The total budget of new infrastructure to the tune of 871,285,000 rands has been set aside for the above mentioned project. The department is completing the planning and design of the new Witbank Tertiary and Impungwe Psychiatric Hospital. Madam Speaker, it gives me a great pleasure to report to this House that the following project has been, and some will be completed during this financial year. New Kamdladla Clinic is completed, upgrading of Roferere Hospital Oncology, Chemotherapy Ward, and new Bankop CC. The following projects were completed for the COVID-19 isolation facilities: conversion of 12 cubicles from Bejega Clinic, conversion of 12 cubicles for Greenside Clinic, renovation of Babaton TB Hospital, renovation of Babaton Hospital ICU, renovation of existing ward in Emelo, construction of new IBT structure for COVID-19 ward in Tonga Hospital, upgrading of Impungwe Hospital, upgrading of theatre in Witbank, renovation of Sanaton TB Hospital, conversion of allied space into COVID isolation in Temba Hospital. Madam Speaker, out of the 1.7 billion budget on infrastructure, we have allocated 21% for maintenance of our health infrastructure to the tune of 364,557,000 rand. This will be towards maintenance of district facilities and maintenance of various life-saving equipment, including coal and diesel. Madam Speaker, when the administration resumed, amongst other interventions to protect our patients and workers, was to look into the issue of security, and I'm able to stand before you and report that strides are being made to improve security in our health facilities by installing concrete palisade fencing in 26 out of 115 health facilities that did not have proper security fencing across the province. This will be a continuous process until all our facilities are properly fenced. The department has started with the installation, commissioning, and maintenance of security technology. The work for security technology has resumed at Witbank, Middleburg, where upgrade on existing security technology equipment has been done. The department will prioritize hotspots, facilities such as Msokwaba Clinic, Kwamhlanga Hospital, and ML Hospital, and will phase in with other facilities. The installation of Rob Ferreira is currently underway and at 70% work in progress. Madam Speaker, improving human resources for health management and leadership is a cornerstone of our intervention as we are service delivery driven. Albeit in budget cuts on compensation of employees during the budget adjustment in 2020-21 financial year, the department managed to fill 1,744 posts, and the department further processed 7,972 temporary appointments, which includes, amongst others, sessional medical officers, malaria spurious, and community health workers. The department has put aside 84,308 million for filling of 476 critical posts during 2021-22 financial year. The department will further replace all posts vacated from 1st of April 2021. Madam Speaker, the impact of COVID-19 has brought great sadness and disappointment that the department had 2,942 employees infected with COVID-19 and 59 of them passed away. May their soul rest in peace, Madam Speaker. Let me appreciate the endless effort of staff in the Department of Health that continuously renders services despite the difficult position they find themselves in. Madam Speaker, it is evidence from the improvement in the audit outcome from the past 5 years that as a department, we have been improving our environment and internal control in the management of the taxpayers' money. We have improved the audit outcome in 2019-2020 financial year. As a department has attained unqualified audit outcome, we will continue to ensure clean financial administration and to ensure that public finances are spent appropriately. The department has built systems to detect, manage, and prevent unauthorized, irregular, fruitless, and wasteful expenditure. According to audited statement, our irregular expenditure improved from 6.4 billion in 2016-2017 financial year to 3.6 billion in 2019-20, while our fruitless and wasteful improved from 16.2 million in 2016-17 financial year to 3.1 million in 2019-2020 financial year. Madam Speaker, we must appreciate that our strategies to reduce accruals are bearing fruits without compromising service delivery, and our accruals improved from 851 million in 2016-2020 financial year to 239 million in 2019-2020 financial year. Furthermore, the department will continue to implement the cost-saving strategies, or what we termed efficiency project, to improve our budget spent while not compromising delivery of services to the more than 4.5 million citizens of the province. Madam Speaker, the department is faced with big challenges of an exposure to contingent liabilities of approximately 10.8 billion as a result of claims related to medical negligence in the main. The department has now developed an integrated strategy which focuses on the preventative clinical governance aspect and litigation management strategy. Madam Speaker, COVID-19 has necessitated that we change the way we offer health care to citizens. The department will be implementing a booking system across all health facilities with the view of decongest our facilities and reduce waiting times. I will encourage that citizens use this system as soon as it is implemented. Madam Speaker, the department will continue with the implementation of the national-driven health patient registration system in hospital and integrate it with the current patient electronic system to ensure that we are able to link and track patient activity from primary health care to hospital care. The department embraced the fourth industrial revolution and will continue to use ICT technology to support effective quality healthcare delivery. We'll also be investigating the scope of telemedicine and other high-tech solutions to increase our hard-to-reach citizens. Madam Speaker, to improve efficient health management, the department will be developing and implementing an electronic integrated monitoring and evaluation system for improved decision-making and prompt deployment of resources where they are most needed. And this tool will also assist in rostering of our healthcare professionals and EMS personnel. Honorable Speaker, the budget for 2021-2022 financial year for the Department of Health, Vote 10, is allocated a total budget of 16,204,083,000 rand for 2021-2022 financial year as per the following budget programs. Program 1, which is administration services, has the budget of 332,698,000. Program 2, which is District Health Services, has a share of 10,011,389,000. Program 3, which is Emergency Medical Services, is given 427,635,000. Program 4, which is Provincial Hospital Services, and has a budget of 1,557,109,000. Program 5, which is Central Hospital Services, has a share of 1,476,433,000. Program 6, which is Health Science and Training Services, has a budget of 430,277,000. Program 7, which is Healthcare Support Services, has a total budget of 296,833,000. Program 8, which is Health Facility Management Services, has a share of 1,771,709,000. In closing, Honorable Speaker, I call upon all healthcare workers in the department to embrace a new culture characterized by service, timely execution, and discipline of getting things done. As Mam Charlotte Maklege put it, This work is not for yourself. Kill that spirit of self and do not live about your people. Do not live above your people, but live with them. If you can rise, bring someone with you, close quote. Madam Speaker, to all the people of Mpumalanga who are listening today, from the most beautiful urban centers to the poorest villages and informal settlement, know that today the courageous battle against the COVID-19, TB, HIV and AIDS, and poor healthcare services is on the rise. And I can assure you that this journey will not be one of shortcuts or settling for less. We must, with courage, carefully carry this great gift of freedom and deliver it safely to the future generations. Let us write a history of glory and dignity for South Africa's healthcare system. I thank you.
Thank you, Honorable MEC, for the well-delivered policy and budget speech. I will now call upon the chairperson of the Portfolio Committee on Health and Social Development, Honorable J.L. Tabete, to table the report.
Thank you, Honorable Speaker. Honorable Speaker, I request the House to adopt the budget as tabled by Honorable MEC.
I have a speaker's list in front of me. I will now call upon Honorable J.L. Tabete. You are given 8 minutes.
Thank you, Honorable Speaker, Honorable Deputy Speaker, Honorable Chief Whip, and the Deputy Chief Whip of the Majority Party, Honorable Premier, Honorable MECs, Honorable members of the Mpumalanga Provincial Legislature, our traditional leaders, our acting DG of the Mpumalanga government, our Secretary of the Legislature, Head of Department. Honorable Speaker, it is my honor to rise today on behalf of the People's Movement, the African National Congress, to reflect on the policy budget speech as delivered by Honorable Manzini. Honorable Speaker, it is common knowledge that we debate this budget during this very stormy period for our province and our country at large, for the health system in particular, because of the global pandemic, the COVID-19. Honorable Speaker, we stand here today in this August House to encourage by the moving, insightful and inspiring foresight expressed by the pandemic has brought the brutality of the death into our families, devastation of our economy, and heightened the crisis of unemployment and inequality in our society. Bantu bakithi balahlekelwe ngumsebenzi lomningi ngenxa yale pandemic. Indeed, as MEC said, we must shift to the highest gear. We must shift to the highest gear in order to work hand in hand to defeat this pandemic. We have seen under your leadership, MEC, and the management of the department in our province, it remains recording the lowest transmission of the virus in the province. In the first wave, the second wave, the third wave, still we are recording the lowest transmission. This shows that we remain a caring government and prioritize the lives of our people. Honorable Speaker, it is noticed that the department has, in line with the manifesto of the Glorious Movement, ANC, on health issues about spearheaded by revolutionaries people's movement. The ANC of Mam Charlotte Mateke, as we have characterized her role in the fight against apartheid laws and oppressive system of apartheid. Honorable Speaker, we want to acknowledge the month of June, which holds a special place in our historic struggle against supremacy of this month, 1976, young people, when they said, enough is enough. The MEC used this opportunity to further revive the spirit of 1976 youth to the current youth. You have correctly pointed that young people must draw courage and inspiration from the youth of 1976 as we join hands in fighting this pandemic indeed, and that can only be understood by those who fought for the liberation of this country, not those who oppress and continue to be doomsayers in this province particular. Honorable Speaker, allow me to appreciate and congratulate MEC and the management of the department by living up to the promises that they have made here in this House on the previous policy budget speech. On resolving much complaint, especially about the waiting period on our health facilities by our people. We welcome the implementation of the queue management system on the mentioned facilities that has put in place by the management of the department. It is very impressive, MEC and the management, for able to strike a balance by ensuring that as you lead the fight against pandemic, other health programs did not suffer, as you able to proudly table progress today on what you have done as a department. We also welcome the progress made on the issue of safety and security on our health facilities, but still more need to be done, MEC. The issue of poor workmanship, MEC, by the service provider when they put the walls in our health facilities, it's a challenge. Such as Msokwaba CHC, where palisades are falling apart. We urge our infrastructure implementing agent to do proper monitoring on that regard. We also call our community to be our first line of defending against these crime activities that has overwhelmed our health facilities. Lastly, Honorable Speaker, I want to commend the healthcare workers who continue to deliver services to the people with respect, dignity, professionally. We must learn to appreciate the good work, not to complain always. Honorable MEC, we want to appreciate for the leading forefront in dealing with the issues of pandemic and all the programs of the department at large. We have seen the rolling out of vaccine, the percentage of our recovery rate, the death rate, the low rate transmission. It's very impressive, and continue to give more vaccine, especially to our elderly people. The provincial COVID-19 stats are scientific. That is proof that our province is indeed hard at work. We also appreciate the partnership you continue to advance with public and the private sector. Ngoba indzaba yetempilo MEC yethu sonke ayisiye department kuphela. MEC continue to be innovative, proactive, and do the contingency planning in order for you to deal with the other challenges that are facing by the Department of Health. Ungalaleli bantu labahlala baphethe i-red pen kodwa ma results abo aphuwa. I thank you so long.
Honorable Mkhabela, you are given 5 minutes.
Greetings to you, Honorable Speaker, to the Leader of the Official Opposition, Honorable MC Sedive, members of the Executive Council, and all honorable members. Honorable Speaker, just like the Department of Education, the Department of Health control a significant budget more than any other department in the provincial government. But this is the worst dismally performing department that has been obtaining disclaimers and qualified audit opinion for more than 10 consecutive financial years. You know why? Because there is no political leadership in that department, and some of the administrators, like the acting HOD, Dudu Zelim, are corrupt and rotten to the core. And she enjoys protection from the politicians, including the MEC and the Premier. Honorable Speaker, this is the department that is always mired by controversies and is currently in court defending an unqualifying company that was irregularly awarded a lucrative tender of more than 648 million, even though it was not meeting the mandatory requirements like a mere UIF compliance certificate. Honorable Speaker, I wonder why the department will take side and go to court to defend fraud and corruption instead of honestly doing an internal investigation and disqualify the non-qualifying company and charge all the officials who are directly involved in the flawed process. But this will not happen precisely because the politicians have self-centered interest in the tender. Honorable MEC, there is a serious criminal case against 8 of your officials, including your trusted HOD, with the Hawks. And I hope and believe that this will not point to you as well at some stage, because heads will roll and there is substantial evidence that there was a fraud and corruption in the awarding of the tender. And Honorable MEC, you must be prepared to hire new senior managers because some of the 8 are gone and there is no two-way about it. As I conclude, Honorable MEC, you must know that the EFF will hold you and the Premier accountable for any loss of life due to the non-functionality of the medical depot for 3 weeks now, as a result of the fraud and corruption that took place in your department under your watch. And you must also not forget that the EFF has forewarned you and the Premier about the tampering with the medical depot, as it is the fountain of the life of the people of this province. We have gone for 3 weeks without medication and other critical surgery sundries, including PPEs for the doctors and nurses. Be rest assured, Honorable MEC, that once the Hawks is done, we will come in this very same August House and debate the step aside to both you and the Premier, because you have participated in the fraud and corruption and the department as well as in the killing of our people by not giving them the medication they so dearly need in order for them to continue living. Therefore, Honorable Speaker, as EFF, we're not in support of this budget vote. I thank you.
I'll now call upon Honorable RJ Sitole. You are given 4 minutes.
Thank you, Honorable Speaker. There is a concerning trend in the Department of Health that is making more headlines, where patients are left to die or permanently scarred due to medical negligence. The Department of Health in Mpumalanga has been struggling for many years to provide health care to the people of this province, and the situation is worsening. COVID-19 just exposed how deep the rot is. Way before COVID-19 came to our shores, the holes were visible. Honorable Speaker, year after year, litigations are getting more and more due to medical negligence. In the 2020-2021 financial year, the department paid in excess of over 18 million for litigations. Currently, the department is sitting with litigations of over 261 million pending just in the first quarter of this current financial year. Honorable Speaker, most of these cases are for children born with cerebral palsy due to negligence during birth. Honorable MEC, one would think by now you would have established a plan or intensified training to reduce the number of these cases and ensure that such mistakes do not take place. According to the department, they did not institute any disciplinary action against any health worker because all investigations apparently did not point to any human error. This is very hard to believe. With the national 3-year freeze on public servants' salary increase and restricted overtime allocations, litigations against the department are more likely to increase. Healthcare workers get overworked. Chronic staff shortages will continue, coupled with undesirable working conditions, a recipe for more human errors that continues to ruin lives and cause long-term damage and suffering to families. Honorable Speaker, the emergency medical services in Mpumalanga is in shambles, to say the least. Once again, the budget for EMS has been decreased by 19%, therefore making it impossible to carry out any recruitment appointments of the much-needed EMS station managers, shift supervisors, advanced life support, intermediate life support, and basic life support paramedics. Can the Honorable MEC tell this House if any new ambulances will be bought or not? The DA welcomes the 9% increase of central and tertiary hospitals and hopes that this increase will be put to good use by ensuring that orthopedic surgeries are prioritized and the waiting period is shortened. The DA would like to urge the Honorable MEC to address the challenges facing the healthcare support services within the department, as this program is vital in assisting the criminal justice system. Honorable Speaker, the case of Mama Rose Mameja in Bushbuckridge points to a broken system that is actually heartbreaking. This is a mother who cannot bury her son, who was murdered 2 years ago and bent beyond recognition during a hijacking. Although anything and everything that is needed to perform a DNA test was collected from her and her whole family 2 years ago, to this day, she's still waiting to bury her son. Every day she is told of backlogs and backlogs and more backlogs. This is wrong. Honorable MEC, when you plan to build any new healthcare facilities for our growing population, please remember that most of the current health facilities are plagued with staff shortages and shortages of equipment. Maintenance of our health facilities is also another challenge. The DA hopes that the 10% budget increase on the healthcare facilities program will go towards addressing this challenge. The DA would like to pay a heartfelt tribute to our frontline workers, the real heroes and heroines who are putting their lives at risk every day in order to save ours and our loved ones. Your selfless acts will be remembered by generations to come. Your sacrifices are immeasurable. We salute you. Honorable Speaker, action speaks louder than words. If the actions can match...
Round up, Honorable Member.
If the actions can match the grand speech that we just heard from the Honorable MEC, maybe we will get somewhere. I thank you.
I will now call upon Honorable Weber. 3 minutes.
Honourable Speaker, I have this little diary in my pocket, and I noted in the diary that this is a very special day, because whilst I was sitting there, I was presented with this package, and when I looked into it, I saw that there's something very special in this present that was presented to me. It's a packet of condoms. And I want to assure the Honourable MEC that I'm still young enough to use them. And when I looked there, I saw that they are strawberry scented. It's my favorite. And Madam Speaker, this will enable me to write a history of glory and dignity in my life. Now, Madam Speaker, through you, Honourable MEC, you mentioned that you want to write a history of glory and dignity of your department. I want to wish you well in your endeavour, and if I can give support to that, I want to give support to that. And it was mentioned to me, because I was listening very carefully. I didn't write a speech this morning before I heard you. I was listening to your speech. And I was worried when I came here, because I was aware of the fact that there's unauthorized expenditure, irregular expenditure of some billions, and I was worried about that. And I was delighted when I heard this morning that there's an improvement in that. There's an improvement, and I wish you well if there's an improvement, because it's worrying that there's regular expenses of that high amount. If you consider a budget of 16 billion and there's a irregular expenditure of 3 billion, it's still alarming. And I appreciate the mammoth task that rests on your shoulders, the mammoth task. We have experienced something that we haven't experienced for many years, the mammoth pandemic, and you've got to deal with it. You've got to deal with it. It's a mammoth task. And under these circumstances, if you can improve on your budget, I wish you well. Certainly, Madam Speaker, inqola mayibhatshiwe phela akusizi ukuthi sithethise umshayeli. Funa ukuthi sifake amahlombe lapha esondweni sifuqe le nqola ukuthi iphume. Kulezo zinto sizawunsiza siyawusekela nathi ngapha. Madam Speaker, in those few words, I want to once again thank the Honourable MEC for presenting to me this wonderful gift. I will show it to my wife. I thank you.
I will now call upon the Honourable S.J. Manzini, 10 minutes.
Thank you very much, Honourable Speaker, and let me take this opportunity on behalf of the department, welcome all the inputs made by honourable members. Indeed, Honourable Tabete, we will make sure that we improve, and we are happy that you can see the good work that we are doing as a department, and it is acknowledged that there is a lot that we can improve as the department. Hence, also whenever we come to the portfolio committee that you are the chairperson, we always welcome your input, because your input are input that we have got best interest of the community and the people of the province. Hence, we are always looking forward to go to account in your portfolio committee, and everything that you have said is something that you're going to look at, working together with yourself, as you indicated, the issue of safety, which is, of course, as I've mentioned in my policy and budget speech, that this is the priority of the department. You'll remember that even the Honourable Premier was also part of supporting the department in making sure that our workers and the patients, but of course the issue of safety, we need the community to work with us, because those that go and disrupt our clinics and hospital are members of the community. So if we can work together, we can deal with the issue of safety, and then it means that services will not be disrupted. Honourable Mkabela, it is good she even left, because she knows that whatever that she said is not part of what we said, and she knows very well that whatever that she said in this house is not true, and hence there's less to say about that. But in the main, you know, every time it seems as if there's a serious interest. The disrupting that the honourable member is saying at the depot is as a result of what he's saying about whether the tenders and everything. Unfortunately, some of us, we are political head, we don't deal with tenders, but it seems as if the EFF, they've got more interest, especially on this tender. If you can look at all the debate and everything about this thing, the reason why now the community of Mpumalanga are suffering because of medication is because the same people that were there did not want to go out, they vandalized even the depot, and the department is trying to put everything together. Everything was vandalized by the previous service provider. Now we are starting afresh, and we can report that we've already put trucks, they are delivering medication. It's not like there's no medication, but it's because people don't understand that we've got a contract, and a contract will come to an end. And when a contract comes to an end, you must allow the people and the province to get, especially it's sad and embarrassing. You know, you can do it and delays in other departments, but on the Department of Health, on medication, and you come back, you want to accuse the department on something which is beyond our control. But I want to assure the people of the province that the department is back on track. We are trying to make sure that all the medications, they reach the clinics, and everything will be back to normal. Honourable Sithole, I'm happy because at the end you have summarized and said it was a good speech, but let me assure you it's not a good speech. This is a plan that we are going to do as a department. Everything else that you have said I will ignore. I'll focus on what you said, the last part, a good speech, and we hope that this is, so as I'm assuring you, it's not a speech, it's a plan that the department will come here next year and report on the progress on everything that we said we're going to do as a department. Honorable Weber, I am happy that you like our condoms and we're happy that you're going to be safe, and I'm happy that you are pledging your support to work with us. That's the reason why all of us, we are elected to come to this house. We are elected to come and make sure that our people get quality services. And it's not about criticizing. You're not contributing through criticizing, but you're contributing to positive input that will make the department to function even better. The Department of Health, the Premier alone, all of us as a provincial government, we need the legislature, Honorable Speaker, to make sure that from time to time they assist. It's good that we did receive some induction, but sometimes it seems as if along the way it is lost. It's for us to support and work with the department and make sure that through the portfolio committee we are assisted and we work together for the benefit of the people of the province. Thank you very much, Honorable Speaker.
Now the question before the House is whether we agree to adopt the report as tabled by Honorable J.L. Tavete. Agreed to?
Agreed.
For record purposes, I will request the Secretary to read the second order before I call him to read the third order.
Order number 2, consideration and debate on the report of the Portfolio Committee on Health and Social Development, Vote 10, Department of Health.
The Secretary shall read the third order of the day.
Order number 3, policy and budget speech on Vote 4, Department of Cooperative Governance and Traditional Affairs.
I now call upon the MEC for Cooperative Governance and Traditional Affairs, Honorable B.P. Shiba, to deliver the policy and budget speech.
Thank you very much, Madam Speaker. Honorable Masilela, Deputy Speaker, Honorable J.J. Skosana, Honorable Premier, Ms. R.M. Tsipane, and colleagues in the Executive Council, Honorable members of the Mpumalanga Provincial Legislature, Chairperson of the Portfolio Committee on COGTA and Human Settlement, Honorable C.G. Chabalala, Chairperson of the South African Local Government Association in Mpumalanga, Councillor M.G. Chirwa, Honorable Executive Mayors, Speakers, Chief Whips, and Councillors. Chairperson of the National House of Traditional Leaders, Ikosi S.E. Mahlangu, Chairperson and Deputy Chairperson of the Provincial House of Traditional Leaders, Inkosi S. Ngomane, and Ikosi C.M. Mahlangu. Our Reverend Amakosi Mahoshi, Acting Director General, Mr. T.P. Nyoni, Management of the Department of COGTA, led by the head, Mr. S. Ngubane, HOD is present, the Secretary to the Legislature, Mr. H. Shabangu, Apostle Nikros Manana, who is here with us today, compatriots and fellow citizens, Lochani. Madam Speaker, this day invokes memories of an eminent South African, Charlotte Manyema Maxeke. Her achievements as the first female university graduate in South Africa, in the United States, and the first female to attend the establishment of the then African Native Congress, which was renamed the African National Congress later, were unparalleled. Her character shaped a generation of leaders domestically and outside the country. Today, as we table this policy and budget speech of the department in this august house, we do so inspired by Charlotte Maxege's character and her determination to serve her country, men and women. The declaration of 2021 as the year of Charlotte Maxege by the ruling party is not misplaced. Pursuant to Maxege's aspirations, our department will spare no effort in supporting local government and traditional leadership. We also present this policy and budget speech with sheer appreciation of the daunting task that lies in our hands of contributing towards saving the lives of our communities in the midst of the brutal and merciless COVID-19 pandemic. We continue to support government programs and initiatives in curbing the spread of the pandemic during this third wave confirmed in 4 provinces. We extend our condolences to the families, traditional leaders, councillors, friends, and colleagues, as well as community members who have succumbed to the pandemic. On delivery of basic services in the second decade of local government. Madam Speaker, the delivery of basic services is a constitutional imperative that we aspire to achieve, Section 27, which states the following. Everyone has the right to have access to sufficient food and water. Lays a solid foundation. The 2 decades of our democracy have brought to the fore the unprecedented water consumption, not only in Mpumalanga, but in the country. We are the 30th driest country in the world, as proven scientifically, and the COVID-19 pandemic has exacerbated the situation. The legacy of apartheid and the poor infrastructure maintenance contributed immensely to this situation, with the rural areas being the hardest hit. Our analysis demonstrates a significant improvement in the number of households with access to water, electricity, and sanitation, with a decline in the area of refuse removal. This analysis is based on the household survey conducted between 2016 and 2019 by Statistics South Africa. These improvements are as a result of the massive collaborative efforts between the 3 spheres of government to make the difference in the lives of our people in Mpumalanga. Madam Speaker and honorable members, we have recorded an increase in the number of households with access to water from 1,090,892 in 2016 to 1,134,864 in 2019. Similarly, an achievement was recorded for sanitation, with the number of households with access to flush toilets rising from 607,082 in 2016 to 848,484 in 2019. Access to electricity increased from 1,123,038 in 2016 to 1,200,132 in 2019. For refuse removal, the number declined from 594,892 in 2016 to 499,500 in 2019. As a remedy, the MIG framework has been revised to allow municipalities to procure solid waste removal trucks through their MIG allocation, and this will improve access to refuse removal. In the 2020-2021 financial year, the department assisted municipalities such as Msualigwa, Mkondo, Bushbuck Ridge, and Dr. J.S. Moroka with approval to procure the waste management equipment, and will continue to support other municipalities going forward. We must emphasize, Madam Speaker, that these achievements were recorded within the context of the population growth, the mushrooming of informal settlement, and the sporadic cases of land invasion. Unfortunately, these factors negate the massive unprecedented investment into the municipal park infrastructure by the government, with the support of the private sector over the past 2 decades of our democracy.
It is for this reason that we express our confidence that the figure will improve after the latest census, owing to the continued investment in the bulk infrastructure. More work lies ahead, and we shall never rest until all households have access to the basic amenities. I believe that a solid foundation for the imminent sixth administration of local government has been cemented. The new administration must double the effort to deal with the following challenges, which include but not limited to the aging and dilapidated infrastructure, which causes massive and unaccounted for water and electricity losses, the exponential sprouting of new legal and illegal settlements with the eventual tempering of the infrastructure are causing excessive damage, lack of budget allocation for the maintenance of the infrastructure. Our determination to confront these challenges with vigor should inspire our communities that water and sanitation, refuse removal, and electricity will be delivered even to those whose hope is fading away. And the inadequate financial resources, Madam Speaker, continues to dent our determination. Hence, our reliance on the municipal infrastructure grant to finance some of the infrastructure project. The MEG expenditure in our province exhibits good progress in funding service delivery project in the various financial year. From the adjusted allocation of 1.73 billion, a total of 986 million was prioritized for water and sanitation project, and the difference of 777 million was committed to other projects such as installation of street high mast light, solid waste roads, stormwater and sports facilities. This investment has created a total of 4,115 job opportunities across all our municipalities. Despite the difficult conditions in the year under review, with serious adverse pandemic conditions, municipalities have been able to put up a positive performance of 83% expenditure by end of May 2021. Whilst our records show there are positive indicators of most municipalities spending 100% towards the end of June 2021, much support shall be directed to the severely affected, such as Dipaliseng, Dr. Pixiga Isakaseme, and Governing Begi municipalities. We have since partnered with, amongst others, the Municipal Infrastructure Support Agent, MISA, the Department of Water and Sanitation, our DBSA supported PPMU in the department to effectively turn the tide against the water and sanitation challenges in the province. We are also in talk with Rand Water as our only proclaimed water board in the province to lend a hand through their development fund and technical expertise to improve the operations and maintenance of our treatment plants and to train personnel as process controllers to meet the standard and classification grading as a requisite qualification required to operate these plants. Our mission is to embark on a tedious but necessary functionality audit of all water and wastewater treatment plants in all our municipalities. This action will involve the Department of Public Works, Road and Transport, and the Department of Health to ensure that all waste discharged from public facilities such as hospitals, clinics, government offices to municipal wastewater plants are compliant with SANS effluent standard. Madam Speaker, time has passed and our population has grown with settlement expanding on a yearly basis. The need for upgrading our service infrastructure has therefore immensely rocketed. Safe and clean water supply, decent sanitation, reliable electricity connectivities, and the road network that invokes some sense of pride within our municipalities shall serve as our core areas of attention as we welcome the new term of Councillor propel us beyond our 2021 local government election. Working closely on a common purpose with Department of Human Settlement, Department of Public Works, Road and Transport, as well as the Department of Water and Sanitation, its substructures such as Inkomati Catchment Management Agency and Rand Water, as well as Municipal Support Agent, we are convinced we shall be fully equipped to confront these ever-teething challenges in municipalities to our remarkable successes on district development model and integrated development planning. Madam Speaker, our 3 district municipalities have been supported to develop their DDM profiles, which have since been summarized. The profile constitutes baseline data to inform integrated planning, budgeting, implementation, and reporting across the 3 spheres of government through the one plan, one budget of each impact zone. The President has appointed ministers and deputy ministers as district champions to work with provincial champions and district political leadership to oversee all government efforts aimed at curbing the spread of the virus, saving lives and livelihood of communities. The process of introducing the appointed national champions to the Provincial Executive Council was carried out successfully through coordination by the National COGTA, Provincial COGTA, and the Office of the Premier. Progress on the implementation of the work stream is reported regularly through the DDM councils, technical teams, and provincial IGR structures such as MUNIMAC and Premier's Coordination Forum. Madam Speaker, public consultation for the next review of IDPs were conducted in September 2020, and municipalities were encouraged to identify COVID-19 compliant mechanisms that leaves no community member outside the consultation process. All 20 reviewed 2020-2021 IDP have been subjected to evaluation after submission to the department. Proposals and recommendations based on the evaluation have been provided to municipalities to consider adjustment of IDP in line with Section 32 of the Municipal Systems Act. Adjustments of reviewed IDPs have ensured that municipal plans complied with legislative requirements governing municipal planning, adequately respond to priorities identified by communities and key service delivery challenges which affect municipality, and pay attention to emerging challenges such as the COVID-19 pandemic and gender-based violence and femicide. 2021, Madam Speaker, represent a local government election year, and as such, after the commencement of their term of office, newly elected municipal councils shall be expected to develop new 5-year IDPs as required in terms of the Section 25 of the Municipal Systems Act. The development of this new generation of IDPs marks a new era of institutionalized long-term planning in the province, as they shall be the driving force behind the implementation of the DDM-1 plans. The process of developing the 1 plans is at the advanced stage, as draft documents are currently finalized at each impact zone and shall be adopted by all government institutions and entities across the 3 spheres by end of June 2021. We shall continue to prioritize our rural communities, which are still struggling to access basic services and government amenities after 27 years of democracy, by ensuring that we develop new DDM-aligned IDPs that respond directly to their needs and priorities. This effort requires that our traditional leaders must be at the forefront of development and participate meaningfully in the municipal planning process serving in the best interest of their traditional communities. On planning and land use management, Madam Speaker and honorable members, the need for service land by communities cannot be divorced from the reality of land invasion. The department was established and launched a provincial governance structure to address the problem of land invasion, not only by implementing reactive measures, but by also intervening
proactively. The department, through the support of the BSA, will initiate process of reviewing the SDFs of Nkangala District, Tembisile Hani, Dr. J.S. Moroka, Victor Kanye, Emalahleni, and Emakazini municipalities. The review of this SDF is necessary to guide planning in line with current development trends and legislative requirements. More importantly, the department will continue implementing the project for the development of the Nkomazi Regional Special Development Framework. The department has previously committed to support LIQA on the development of land use scheme, and this has been achieved, which is necessary for the regulation of land use. We commit ourselves as a department to support the Dr. Pixley Isaka Semedi, Paliseng and Bushbuckridge municipalities to finalize their land use scheme as required by the Spatial Planning and Land Use Management, which is Act, which we call SPLUMA, on unemployment and job creation. Madam Speaker, our development initiatives as a country is plagued by the triple effect of unemployment, inequality, and poverty. The 43.1% of the unemployment figures pronounced by Statistics South Africa draws our attention to the risk of implosion. Furthermore, it does not augur well for the developing countries such as ours. Our commitment to make a dent in the growing trend of unemployment is firmly rooted in former President Nelson Mandela's vision of a future South Africa free from the shackles and unemployment and other related social ills. In this commitment, Madiba remarked, and I quote, "We pledge ourselves to liberate all our people from the continuing bondage of poverty, deprivation, suffering, gender, and other discrimination." Close quote. We view our effort of supporting municipalities for the effective functionality of local economic development forums in the same vein as Madiba's vision. This support remained a key lever to address unemployment, poverty, job creation, SMMEs, youth and women empowerment. To this end, Madam Speaker, 3 partnerships have been established with all mutual Trans-African concessions, which is Track and 4, and Voices on Youth to implement the provincial anti-poverty strategy. The department continues to support municipalities in creating jobs through its community works program and EPWP Youth Waste Management Project. A total of 28,672 work opportunities were created through the Community Works Program in all 17 local municipalities, whilst a total of 140 work opportunities were created through EPWP Youth Waste Management Project in municipalities such as Nkomazi, Dipaliseng, Bushbuckridge, and Mkondo. It is worth mentioning that with the support of the department, the Nkangala District has established and launched the Nkangala District Economic Development Agency to stimulate local economic development. This move is supported wholeheartedly as it takes the shape of a district development model which promotes the coordination of efforts from a district-wide approach. On local government election, Madam Speaker, as I indicated earlier on, 2021 marks the local government election year. By implication, this will mark the end of the current term of the 5th local government administration. The election will be held on the 27th of October 2021. As a department, we have already started providing the necessary support to the IEC to ensure that the elections are free and fair. In this regard, we have established both the district and provincial task team comprising of all local municipalities, sector departments, and the private sector, which are tasked with ensuring that all voting stations have all the required services such as access road, water, electricity, and network connectivity. The department has also provided the Provincial Disaster Center to the IEC to use as its provincial election center. On institutional and administrative capability, Madam Speaker, with the current local government term of administration coming to an end, So are the contract of various Section 54, Section 56 managers. This charges the department with the responsibility to support all municipalities in the recruitment of suitably qualified individuals to fill the envisaged vacant post in this financial year. We must ensure that all municipalities have filled their top 6 posts of municipal manager, chief financial officer, director corporate services, director technical services, director community services, and director development and planning as a matter of agency. We believe that if these posts are filled, municipalities can have stable administration. The role of the department shall be to do oversight and monitoring to ensure that the content of Section 56 are fully adhered to. We have noted that our municipalities continue to perform badly on finance management. The department is considering re-establishing the Municipal Finance Directorate in the 2021-2022 financial year. This directorate will enable us to provide more hands-on approach to municipalities in financial matters such as dealing with unauthorized, irregular, fruitless, and wasteful expenditure, implementing of anti-corruption measures and the Municipal Property Rates Act, and improving the audit outcomes. We will be engaging the Provincial Treasury on how best we can collaborate on this matter, on municipal intervention. Madam Speaker, last year, when we presented our policy and budget speech, we indicated that on 17 January 2020, the Executive Council resolved to intervene in the Dr. J.S. Moroka local municipality in terms of Section 139, subsection 1B of the Constitution of the Republic of South Africa. We are indeed satisfied that the intervention has yielded the desired results. As a result of the progress made, the Executive Council resolves to terminate this intervention on the 7th of April 2021. I must, however, hasten to indicate that there are still some areas that are being addressed in Dr. J.S. Moroka, and the department is continuing to provide support in terms of Section 154 subsection 1 and Section 155 subsection 6 of the Constitution of the Republic of South Africa of 1996, read with Section 105 of the Local Government Municipal Systems Act of 2000. Madam Speaker, on the 12th of May 2021, the National Cabinet took a decision to intervene in the Ligwa local municipality in terms of Section 139 subsection 7 of the Constitution of the Republic of South Africa, read with Section 150 of the Local Government Municipal Finance Management Act of 2003. This therefore culminates into the dissolution of the Municipal Council and the subsequent appointment of the administrator, Mr. Johan Medler, who comes with vast and rich local government experience, knowledge, and expertise. We commit ourselves in supporting Mr. Medler and his team and appeal to the stakeholders in the municipality to do likewise. Honourable Speaker, Mr. Medler is joining us in this sitting, and with your permission, Madam Speaker, may I urge him to stand up for the House to recognize him. Thank you very much. Madam Speaker, in pursuit of good governance in our municipalities, the department has also intervened by conducting investigations in terms of Section 106, subsection 1B of the Local Government Municipal Systems Act of 2000 in the following municipalities: Governor Mbeki, Ligwa, Dr. J.S. Moroka, and Dr. Pixiga Isakasem. The investigations in these municipalities have been completed, and the reports have been handed over to the municipal councils for them to implement the recommendations. We are monitoring the implementation of these recommendations. The department has also intervened in the following municipalities, and the investigations are currently underway: Nkomazi and the Palising. Once these investigations have been completed, they will also be handed over to the respective municipal councils for them to implement. The department is also finalizing the appointment process of investigators to conduct investigation in terms of Section 106, subsection 1 of the Local Government Municipal Systems Act of 2000 in the following municipalities: Emalahleni and Bushbuckridge. These investigations are a clear indication that as government, we will not allow any act of malfeasance in our municipalities. Where corruption rears its ugly head, we will not hesitate to act. We are committed to a clean governance driven by the will to serve our people. On public participation, Madam Speaker, in this financial year, we will be seized with the mammoth task of reconstitution of ward committees after the local government election. We will ensure that we have the correct representation of stakeholders on these committees. Subsequently, an induction and training of the ward committees will ensure as part of capacity building. As we reconstitute these ward committees, we must ensure heightened participation in these processes by all communities, particularly those staying in urban areas. We must all begin to appreciate the importance of the ward committee structures in deepening democracy at the local level through participation. Credit goes to the CDWs for their sterling work over the years. In the midst of the COVID-19 outbreak, they went an extra mile to reach out to the communities during the lockdown, risking their lives in order to save humanity. Your commitment and selfless has not gone unnoticed. Siyabonga, niqhubeke njalo. We note the issues raised by organized labor, NEHAU, as far as the functioning and the roles of CDWs are concerned. And guidance in resolving these matters is sought from the Department of Public Service and Administration. These issues shall be attended to in due course. On disaster management, Madam Speaker, our province sits on the edge of disaster. As such, we were visited upon by the debilitating tropical cyclone Eloise, causing massive damage due to heavy rains here in Mpumalanga and elsewhere in the country. The collapsed housing units and bridges, the defects in schools and health facilities are a reminder that we are a province prone to such natural phenomena. The reconstruction of the damages caused to the infrastructure is our preoccupation. As the Premier indicated in the State of the Province address earlier this year, approximately 1.3 billion is required for this purpose. The National Department of Cooperative Governance and Traditional Affairs has since declared a disaster in our province, and as such, 200 million was made available to address the damages in accordance with the Disaster Management Act, focusing on housing units to provide shelter for the destitute families, reconstruction of collapsed bridges, health facilities, and school buildings. Through this financial injection, the reconstruction of the Tegwane South Bridge that connects Mbombela and Kanyamazane in the city of Mbombela municipality will be attended to ease the traffic congestion on the N4 roads. We appeal for your patience while the Department of Public Works, Roads and Transport attend to it. On support for the institution of traditional leadership, Madam Speaker, the department presented the report of the Nhlapo Commission to the Bakhatla, Bamoka, Bamaluka Traditional Council, which recommended Mr. Silo Harris Maluka as a senior traditional leader. Similarly, a report of the Tolo Committee on Dispute and Resolution of Traditional Leadership, recommending Mr. Richard Nkosi as the rightful heir to the throne of Ebutsini Traditional Council was presented to members of the royal family. This was done in our quest to bring to a finality to the pending matters that fuel the instability in some royal families. We urge members of these royal families to accept the outcome of the findings, including those whose viewpoint is against the outcome. We also congratulate Inkosi Mjogwana II of the Sibosho Traditional Council in his coronation, which took place recently. We hope his ascension to the throne brings hope for Stability, Cohesion and Development in the Siboshwa Traditional Council on key legislation and reconstitution of Traditional Council. Madam Speaker, pre-planning has already started in preparation of the process to reconstitute the Traditional Council, as the Premier indicated during the opening of the Provincial House of Traditional Leaders last month. I wish to reiterate, same to this sitting today, that an extensive consultation of all stakeholders and role players shall be undertaken to ensure that the process not only become a success, but is legitimate, free and fair. The process for the reconstitution of the traditional councils will culminate into the closure of this long outstanding matter, which could not be attended to due to a lack of framework to guide the elections and how the councils should be constituted. The new piece of legislation marks a new era for the recognition of traditional and Khoisan leaders in the country and in Mpumalanga. It forms the basis for the establishment of the House of Traditional Khoisan Leaders and a commission. Like all other departments in the country, our department is in the process of putting together plans to support the traditional councils once they are established. Madam Speaker, the unfortunate fatalities that occur during the practice of Ingoma are being pursued relentlessly. Following the proclamation of the Customary Initiation Act number 2 of 2021 on the 4th of June 2021 by Honorable President, we therefore must establish as a matter of agency the Provincial Initiation Coordination Committee, PICC, following the dictate of this legislation. The establishment of the PICC through this act, this proclamation is in line with our Provincial Ingoma Act and should not be viewed as a substitute. Our department is hard at work to establish the PICC on rural development initiatives through agrarian revolution and Invest Rural Master Plan. For a long time now, the institution of traditional leadership has been inundated with socio-economic challenges in traditional communities, with almost limited strategies intervention tailor-made to advance their livelihood. We have been graced by the wisdom of the National House of Traditional Leaders with its capable leadership of our own Ikosi S.E. Mahlangu to put in place the national approved Invest Rural Master Plan for all provinces. The plan looks at all possible phases of development in agriculture, agro-processing, mining, manufacturing, land development and retailing, anchored on strong principle of economic reconstruction and recovery, already announced by His Excellency our Honorable President Ramaphosa and duly supported by our Honorable Premier Mthweni Tsipane in his State of the Province address. The master plan is breaking new grounds for the development and advancement of Amakosi and their communities, converting natural resources, which are a comparative advantage in most traditional communities in terms of the means of production, into meaningful goods and services that shall draw traction in the market and thereby supporting a sustainable boost in the current fragile and fractured economy is surely an inevitable step towards the right direction. The master plan shall be rolled out with support from local houses linked to the DDM and the Provincial House of Traditional Leaders, working closely with our Provincial ESCO in executing this through relevant MECs and their department. Sekuyiso isikhathi sokuthi amakhosi abambisane ngokwedlulele nohulumeni ukwenza impilo zabantu zithuthuke ngokuthi bazikhiqizele ngokusemthethweni umnotho ozoqeda ububha nendlala. We will work so tirelessly to make this a reliable fortune for our traditional communities. With true and effective cooperative from all stakeholders, we vow to stand above shoulders in making this a success. The scourge of the gender-based violence and femicide ravaging our communities has drawn the attention of the traditional leaders through the Emakosikazi structure, this plaque is being confronted head-on. Siyabonga, Makosigadi. In conclusion, Madam Speaker, I wish to extend my deepest gratitude to my predecessor, the Honorable MEC, Mr. Mandla Msibi, for his leadership role in the department. He steered the department to a yet another clean audit bestowed for the 7th time. Working together with all role players, especially the administration team led by the HOD, Mr. Sam Gubane, I hope to replicate same during my term. As I commit myself, each day will count in order to achieve the invaluable task of serving our nation, inspired by the spirit of servant leadership displayed by Umama Charlotte Maxege. I look forward to a solid working relationship with the House of Traditional Leaders under the stewardship of Inkosi S. Jingomane, members of the Portfolio Committee on Human Settlement, Cooperative Governance and Traditional Affairs under the very capable chairperson, Honorable C.G. Shabalala. It is therefore my singular honor and privilege to table the budget of the department, and I accordingly request the House to approve the amount of 731,241,000 for the 2021-2022 financial year, allocated as follows. Program 1, Administration, 152,249,000. Program 2, Local Governance, 204,123,000 rand. Program 3, Development and Planning, 247,798,000 rand. Program 4, Traditional Institutional Management, 107,385,000 rand. Program 5, House of Traditional Leaders, 19,686,000 rand. Honorable Speaker, let me express my sincerest gratitude to the Honorable Premier, Ms. Refilwe Mthweni-Tsipane, for affording me the opportunity to serve the people of Mpumalanga. My special appreciation goes to my family, led by my husband, Mr. Shiba, for continuous support and understanding. Madam Speaker, kindly indulge me to say this. Ubabu Shiba is birthdaying today. It's turning 60 years. Ngimfisela ukukhula okuhle kwangathi uJehova angaba naye. The responsibility would have been much harder without them. Ukhona Ubab Shiba phakathi kwethu, ngithi happy birthday. Thank you very much, Madam Speaker. Uhleli lapha phezulu ngamcela ukuthi asukume. It means MEC Manzini sekane client in terms of vaccination. Thank you very much.
Thank you, Honorable Shiba, for the well-delivered policy and budget speech. The Secretary shall read the fourth order of the day.
Order number 4, consideration of a report of the Portfolio Committee on Human Settlements, Cooperative Governance and Traditional Affairs on Vote 4, Department of Cooperative Governance and Traditional Affairs.
I now call upon the chairperson of the Portfolio Committee on Human Settlements, Cooperative Governance and Traditional Affairs, Honorable G.C. Shabalala, to table the report.
Thank you, Honorable Speaker. With the powers vested in me as the chairperson of the Portfolio Committee, on behalf of the Portfolio Committee on Human Settlements and COGTA, we ask the House, the August House, to accept or to adopt the report. Thank you.
I am informed that there is no debate on this report. Now the question before the House is whether we agree to adopt the report as tabled by Honorable Shabalala. Agreed to? As so agreed.
Agree.
The Secretary shall read the fifth order of the day.
Order number 5, Policy and Budget Speech on Vote 9, Department of Community Safety, Security and Liaison.
I now call upon the MEC for Community Safety, Security and Liaison, Honorable V.R. Shongwe, to deliver the policy and budget speech.
Honorable Speaker, the Deputy Speaker of the House and the Chief Whip of the Majority Party, the Honorable Premier, Mrs. Refilwe Mtsweni-Tsipane, our Honorable Members of the Executive and Honorable Members of the Legislature, Chairperson of the Portfolio Committee, Honorable Nora Mahlangu, Executive Mayors who might be here, as well as district and local municipalities, the Chairperson of the Traditional House, Ubabe Ngomane, the Acting Director General, Ubaba Peter Nyoni, the Acting Ochodi of the Department of Community Safety, Security and Liaison, Mr. Godfrey Ntombela, and other heads of the departments, Major General from SAPS, General Pasha, the African National Congress Acting Chairperson, Ubaba Undlovu, and the rest of the leadership from other parties as well, representatives from the SAPS and representative from the business community, representatives from labor fraternity, distinguished guests and members of the public, members of the media, ladies and gentlemen, Sanbonani. Honorable Speaker, 27 years after apartheid was dismantled, and in the year declared for Charlotte Maxeke, the struggle for the true equality of women remains a pipe dream. In the year of Charlotte Maxeke, and in her honor, gender equality and addressing the plight of women must start in earnest and take a center stage in the building of a cohesive and non-sexist society. She stood up against the abuse of women and provided dedicated support to women who came into conflict with the law because of abuse by their counterparts. She also advocated for the independence of the structures of women and encouraged women to participate in forging unity in the mass struggle of our African women. Madam Speaker, the struggle for the emancipation and equality of women must be fought at all fronts. And Madam Speaker, we table this budget vote at the backdrop of a very significant month in our calendar year, which is June, this month, within which we pay tribute to the selflessness and resilience of young people of 1976. These young people played an important role in the struggle for the liberation of South Africa. We have made a lot of progress since 1994, and many people's lives have been improved through numerous programs that our progressive ANC-led government has implemented in our communities over the last 27 years. However, one of the challenges that continue to bedevil our society is mainly crime. We have seen our people becoming victims of crime in the street, in other public spaces, and even in their own homes. That is why we should continue to relentlessly fight against crime and other social ills with the same spirit of the young people of 1976.
We also see many of these young people being killed in road crashes when they are still supposed to be economically active and contributing towards a prosperous South Africa we all want to live in. Our statistics reveal that most of the road crashes happen during weekends and during the early hours of the mornings. And mostly young people are affected. We have just been employed and are economically, these young people who are just have been employed and people that are economically active, and you find them involved in deadly crashes that happen on weekends and at night when they come from places of entertainment. Honorable members, as we celebrate the Youth Month, we want the young people to become part of finding solution of these many social ills that confront our society today, particularly on COVID-19, which is a serious pandemic. And I want to say, honorable members, the spread of the coronavirus, which is commonly known as COVID-19, has disrupted global economic activities to an extent not seen during the past times. The pandemic will probably push our already fragile economy into deep recession. The economic impact, however, is already being felt as more people are now out of work. We were forced as government and state-owned entities to even reprioritize our budgets in order to adequately respond to the pandemic. Some of our programs had to change, and others could not even be implemented as planned. Madam Speaker, SAPS was also adversely affected because all police stations are repeatedly closed temporarily every time a member tests positive. What must be commended, Honorable Speaker, is that the police management always ensured that service delivery at the affected station is not compromised, despite that particular plight. The rollout of the renewal of vehicles license disc at 18 South African Post Office outlets across the province since last year is another measure that we have implemented to reduce some of the backlogs created by COVID-19 at our DLTCs. Our law enforcement, traffic officers, the police and soldiers were hard at work, particularly at the level 5 of the lockdown, to enforce the law because many people were not complying. Our law enforcement officers placed their own lives and that of their families in great danger by working around the clock to ensure compliance. This obviously put strain on our resources, but it had to be done in order to save lives of our people. One must applaud the officers who heeded the call and availed themselves and still continue to work hard to ensure that there is a compliance even today as we are speaking. We are grateful to the provincial government under the leadership of our Honorable Premier, Umam Refilwe Mtsweni-Tsipane, for the leadership she is providing from time to time. Was it not for our government's response to the scourge, the situation could have been worse. Honorable Speaker, we remain deeply disturbed by some liquor traders who have been shown no regards for the regulations by only prioritizing profits and not lives of those that they sell liquor to. These unscrupulous traders, as we have seen in some of the operations conducted, violated COVID-19 health protocols by, among others, allowing many people in their establishment, not ensuring proper social distancing, and also allowing entry patrons not wearing masks. Honorable members, we have also noted the deadly crashes that occurred during the curfew hours. This past Saturday, around 1 o'clock in the morning, a minibus and a Toyota Conquest hatchback collided head-on. 3 people were killed while 4 more people sustained serious injuries. Madam Speaker, we have utilized all our available platforms to encourage communities to comply with the regulations. We will continue to do so even in the current financial year, and the security cluster will play their role by ensuring that those responsible for violating these rules are brought to book. Attack on law enforcement officers. Honorable Speaker and members, during the 4th quarter release of crime statistics, the Minister of Police, General Bugdet, sharply raised the concern about the number of police officers who were killed while on duty and off duty. For many years, when I was still the MEC of this department, I came up with the slogan which says, "Wabulali Poisa, Wabulali Umphakathi." By this slogan, we are mobilizing the communities to refrain from killing or attacking our law enforcement officers. We want everyone to view law enforcement officers as prime protectors of communities, because this is what they truly are. SAPS members, by virtue of their work, are also protectors of the state institution and the rule of law. The police are usually the first on crime and road crashes. In fact, they are always at the site of any imaginable disaster that one can think of. The same with the police officers or the traffic officers who are also amongst the people that are there on the line of those disasters. How do we then attack and allow such people to be under siege by criminals? Any self-loving society will ensure that they expose or report any person attacking our law enforcement officers. There are many hardworking law enforcement officers who, under difficult circumstances, continue to remain true to the badge. They are not even afraid to arrest anyone who go errant, whether that person is a police or a traffic officer. That is why there are some police officers who are in prison while others are going to courts for various offenses that they have committed. We must all work hard to ensure that we restore a sense of respect within the communities towards the law enforcement as a whole. We will continue to work hard as we prepare for the society that will envisage to see in line with the Vision 2030. Communities must respect the police and work with the police in order for us to build a crime-free Mpumalanga province. We should remember that every time the police leave their homes, it is not guaranteed that they will return home safely or unharmed. I'm saying this again, that we should not allow anybody to attack our police. And I want to repeat in this house by saying, Wabulali Poisa, Wabulali Umphakathi. On the Overall Friday, the program of Overall Friday was launched many years ago, and it was used as an important vehicle to promote law enforcement visibility in identified areas where it is implemented. It also brings together various members of JCPS to work together in making a meaningful contribution. JCPS is Joint Cluster, Security Cluster, and all security agencies, Honorable Speaker. That is the language yasemapoiseni and safety and in the safety and security. Since I have arrived in the department, we have reintroduced the program and it will be vigorously implemented in the current financial year as part of promoting law enforcement visibility while targeting crime and also ensuring compliance by liquor traders to their trading licenses and also to the lockdown regulations. We've already started in some areas with the little resources that we have. Beksesenga status was coming. Traffic Intervention Unit and Technical Response Team. Madam Speaker, as part of combating crime, I have already called on the Justice, Crime Prevention and Security Cluster Management 2 Enhanced Technical Response Team. This team has the enormous capacity to deal with heinous crimes in our communities. We also need this team to assist us in curbing gang-related violence, crime in some parts of our province. We are going to relaunch also the Traffic Intervention Unit to ensure that they support our heightened drive to curb reckless and negligent driver behavior on our roads. On road safety, Honorable Speaker and members, during the Easter weekend 2021, 121 road crashes took place, resulting in 18 fatalities. Furthermore, 73 people sustained serious injuries and 132 slight injuries were also recorded. For 5 years period, on average per day, there were 24 crashes, 4 fatalities, 15 serious injuries and 26 slight injuries. These are not just numbers, but people we know, breadwinners and our young people. We will continue to put various efforts to ensure that our roads are safe in the province. We will urge the Minister of Transport and fellow members in the MINMEC to ensure that the ARTO regulations are implemented and implemented to the latter. This, we believe, will result in serious road transgressors denied privilege to drive on our roads. It will also go a long way to ensure that due revenue is collected, which will deepen country's vision of a better life for all of us. The department will ensure that on an incremental basis, improve the corporate image of traffic law enforcement officers by ensuring they wear presentable uniform. I want to repeat, presentable uniform, and that their vehicles are accordingly blended. We will therefore gradually work towards increasing the current fleet. Last year in December 2020, we received 49 vehicles donated by RTMC. Honorable members, Overload Control Unit and licensing of vehicle of trucks in the province will receive our urgent attention so that it is done in such a way that it enhances revenue. Road accidents are another major concern because they usually lead to deaths. But we know that most accidents are caused by people who are not properly tested. It is for this reason that we are at an advanced stage of reinstating the investigation unit, which will work closely with SAPS to arrest corrupt officials who sell driver's license and roadworthy certificates. On local government elections, Madam Speaker and members, our country will yet again hold the local government elections in October this year. We are happy to report that as a province, we are ready to hold an incident-free elections. And preparations by all members of the security cluster, working closely with independent electoral commissions and all other stakeholders, we will ensure that we deliver on this promise. On gender-based violence, honorable members, the other issue that I want to highlight is the scourge of gender-based violence and femicide. The scourge, despite many efforts and strategies by government, it remains high. Many women continue to live in fear in the streets and even in their own homes. This is one challenge that requires all of us to work together in making sure that we create the society that we want to see come the year 2030. The Honorable Premier Refilwe Mtsweni-Tsipane, in her 2021 State of the Province address, state said, and I want to open the quote, "Until such time that our people are free from fear of personal, physical and emotional harm, we cannot truly say we are free." Close quote. This means we should work together towards eradicating all forms of crimes, particular contact crime such as murder, sexual assault, property-related crime and other serious crimes. This will contribute towards ensuring that our people do not perpetually live in fear. The Honorable Premier further called on the community to report criminals to the police because these people live amongst us, socialize with and commit some of these crimes in our full view. Despite this and many other efforts, the fourth quarter crime statistics as released by the police minister recently showed that total sexual offenses decreased marginally by 3.5%, and this represents a reduction of 28 cases. Sexual offenses increased by 3.5%, which include but not limited to rape and sexual assault. Honorable members, robbery with aggravated circumstances went up by 8.2%. There are 581 cases as compared to the same period last year. Murder cases increased by 5%, and this represents an increase of 50 cases. Attempted murder increased by 1.7%, with a total of 18 cases reported in our province. Honorable members, we need to remember the onslaught of women comes in many forms. They become victims in all other categories of crimes. That is why it is important that while we focus on GBVF, we must also combat all other crimes in our province. We will continue to monitor the implementation of Domestic Violence Act at 8 priority stations with the contributors to the gender-based violence and femicide. The department further monitored 16 priority police stations on the implementation of the Domestic Violence Act on rural safety and farm killings. Honorable members, rural safety and farm attacks remain high on our agenda. The recent incident where two siblings were allegedly, I want to repeat, were allegedly killed by farmers in the Bamboo Skral near Mabola, once more brought a sharp focus on rural safety in our province. The case is still in court, and two of the suspects were arrested again for their alleged involvement in the murder of 2 other people in the same area last year. Not so long ago, a woman was killed along with her son at Crocodile Value farm near Mbombela. The matter and several other cases are still in court. Madam Speaker and members, this is not the time to point fingers. It is time for us to recommit ourselves in ensuring that the implementation of rural safety strategy is fully realized. The attainment of freedom of the 27 years becomes meaningless if there are some people in farming communities who still live in conditions of fear. Tire spikes and law enforcement impersonation. Madam Speaker and members, we have noted with a great concern the barbaric nature of criminals targeting motorists on certain roads in our province by placing spikes on our roads. The province recorded 24 such cases between 1st of April and 18 May 2021. Some of the affected areas include Metlibek on N4 Toll Road in Emalahleni and Belfast, N12 Road near Emalahleni and Delmas, and R40 Road near Calcutta in Bushbuckridge, amongst others. This suspect reportedly placed objects on the road such as tire spikes, slabs, bricks, and large rocks covered in a plastic in order to trap motorists. This incident usually occurs late at night or in the early hours of the morning. Once motorists drive over these objects, their tires get punctured or their vehicles get damaged in the process. So they are forced to stop and inspect the vehicles, and then the criminals will pounce on them. While doing so, the suspect then violently approach and rob them of valuables. The suspects are normally armed with firearms. It is very much important to note, Honorable Speaker and members, that when you come across these particular criminals, you must not rather lose what you have instead of fighting, because the majority of them, they carry a lot of firearms, and some of their firearms that they carry are very dangerous. While we condemn these barbaric acts in the strongest possible terms, we also warn motorists to be vigilant, especially when they drive at night, to always be on the lookout for any foreign object on the road. We're also appealing to our communities to work with the police in trying to resolve this particular challenge. Mpumalanga and Gauteng are working together to deal with this challenge. We have engaged with the MEC of Gauteng as well as the MEC of KZN because we are sharing borders. We will be also going to our neighboring countries, Swaziland and Mozambique. We will be targeting these areas, and fortunately we have our high patrol team that are trying very hard in making sure that we apprehend them. On Administration Program 1, honorable members, the department is taking over licensing function at the city of Mbombela recently. Some of the employees at the affected DLTCs opted to remain behind. They don't want to come to the provincial office, government. The post that was created out of that will be filled in due course because they have already been advertised. Madam Speaker and members, we will continue to focus on strengthening of the compliance environment so that we are able to improve our audit outcome. On Program 2, Civilian Oversight. Honorable members, the department has recruited tourist safety monitors who are deployed in the 42 tourist attraction points. The department will implement 3 Izimbizo and pilot crime prayer days as part of combating crime and road crashes. This will be conducted in 3 regions. We urge our leaders of faith to partner with us in realizing that this idea is implemented. The program, however, through its promotion of safety unit, was able to implement educational and awareness programs on GBVF, trial crimes, school safety, stock theft, and border security, amongst others. To support the culture of teaching and learning in our schools, school safety programs will be supported to ensure that schools a drug and weapon-free environment, as criminal records have negative impact to future prospects for the youth. To strengthen an integrated approach to fighting crime, community policing forums and CFS will be supported as grassroots crime prevention initiatives, which have proven to be effective. On Program 3, which is transport regulation, honorable members, enforcing road traffic law and reducing road crashes, the department will introduce information communication technology which will be linked to the National Traffic Information System. This will assist the implementation of the Administration Adjudication of Rural Traffic Offences Act number 46 of 1998, which is commonly known as ARTO. Honorable Speaker, this rollout of ARTO will play a major role in transforming the handling of road traffic offences from the judiciary process to an administrative process. The ARTO process will further introduce the demerit system, which will be a deterrent to irresponsible drivers. As part of enhancing service delivery, the department received about 49 vehicles from RTMC, as I have said. However, honorable members, we still need more vehicles to ensure that law enforcement operation and road safety education programs are adequately equipped to enhance road safety in our province. On Program 4, the security management will continue with its mandate of securing all provincial government sites and also enhance the awareness of employees on security matters. On budget allocation, honorable members, the budget for the financial 2021-22 has been allocated as follows. Program 1 has been allocated an amount of 157,353 million. On Program 2, Civilian Secretariat, the program has been allocated an amount of 60,520,000 rand. On Program 3, Transport Regulation, this program has been allocated an amount of 687,147,000 rand. On Program 4, this is Security Management, the program has been allocated an amount of 595 million rand and 140,000 rand. We therefore present the total budget of the Department of Community Safety, Security and Liaison Vote 9, which is 1,500,334,000 rand. In conclusion, Honorable Speaker, let me borrow from the words of the late statesman, Dr. Nelson Mandela, I open quote, "Safety and security don't just happen. They are results of collective consensus and public investment. We owe our children, the most vulnerable citizen in our society, a life free of violence and fear," close quote. The Premier has clearly laid out a future of the province, and the department will focus in curbing the crime. I will therefore like to thank the Honorable Premier, Mrs. Refilwe Mtsweni, and members of the executive for their guidance and support. Let me also express my appreciation to the Portfolio Committee on Public Works, Roads and Transport, Community Safety, Security and Liaison under the leadership of its chairperson, Honorable Nora Mahlangu, for their oversight responsibility that the department programs are geared to fighting crime. The team in my department, led by the acting HOD, Mr. Godfrey Ntombela, thank you for the support and commitment, and also to our external stakeholders. Let us continue working together to support to protect our people in the province. My appreciation also goes to my organization, the African National Congress Study Group, under the leadership of the Chief Whip, the Honorable F.V. Mlombo, for the guidance and support they have given us. And lastly, I want to thank my family and my office for the reliable support I've received all the time, including the honorable members and the opposition that from time to time are able to guide and support my department. Thank you very much.
Thank you, Honorable MEC Shongwe, for the well-delivered policy and budget speech. The Secretary shall read the sixth order of the day.
Order number 6, consideration of a report of the Portfolio Committee on Public Works, Roads and Transport, Community Safety, Security and Liaison on Vote 9, Department of Community Safety, Security and Liaison.
I now call upon the chairperson of the Portfolio Committee on Public Works, Roads and Transport, Community Safety, Security and Liaison, Honorable N. Mahlangu, to table the report.
Thank you very much, Honorable Speaker. I rise on behalf of the Portfolio Committee to request the House to adopt the policy and budget tabled by the Honorable MEC V.R. Shongwe. Thank you.
I am informed that there is no debate on this report. Now the question before the House is whether we agree to adopt the report as tabled by Honorable Mahlangu. Agreed to? As so agreed. That brings us to the end of the morning session. The proceedings are temporarily suspended until this afternoon at 2:15. Honorable members, please reconnect at least 10 minutes before 2:15, so that if there are connectivity challenges, the chamber support staff will be in the position to assist you.